If you don't know her, Marcie is phenomenal. I mean, Marcie is just phenomenal. She has a lot of information that will help us. I know, right? I said, she has a lot of information that will help us, and I'm thrilled that that she is here today. And I'm going to turn it over to Marcie. Marcie.
Oh, thank you so much, Lanice. And I think I'm in good company on this call today. It's so good to see all of you, and I see some familiar faces, of course, and some new names too. So thank you so much for having me join today, Lanice and Tanya and the team. Um, I in my role, just to give a brief background for those of you I may not have met before. So currently I work for CVS Specialty, and I'm the National Liaison of Patient Advocacy and Engagement. So I've been working at CVS just over 7 years. And prior to that, I did work in the nonprofit side with PHA for several years out of the Midwest chapter. So I know, Deb, back when you were back in Illinois, I got to see you quite a bit, and it just been involved in the PH community for over 10 years, and just feel so honored to get to do so and try to make a difference. We're all, it's one big family. I know we're all connected, and it takes a team across the board to just spread awareness, get involved, all these awesome activities that Team Phenomenal Hope has set up, and programs and support, and just being able to share resources and spread the word of what's available and be there for each other throughout. So again, thank you so much for having me join today. I know our topic today was really talking through all of the different resources that might be available, and being able to get that support whenever you need it, with regard to benefits or foundation assistance, whatever it may be. So I'm going to talk through some of those in more detail, but really encourage you all, if anyone has questions or personal experiences, anything you want to share, I know this is a great place to do so. And I think learning together, when we've had the opportunity to do this in previous years, it just kind of opens it up to be able to share from each other's experiences and learn together. And I feel like I still learn something new every single day, and that's what it's all about, right? It really is kind of a ever-changing landscape, and that can open up some new resources, but also makes it challenging to keep our finger on the pulse of whatever.
Oops, I'm sorry. Marcie, unmute. I'm sorry. I hit the
Oh
wrong
no,
button.
you're fine. You're fine.
Let's see. I
I was
missed
just
Kira, help
gonna,
me. Okay, go ahead. I'm sorry.
you can hear me okay now. Okay.
Yeah, it was me.
All good, all good. So yeah, I do have some slides I was going to mention that I'm going to share, but really informal. I like it to be really conversational. So please don't hesitate, and we'll be able to talk through at the end as well. So let me pull this up. So just kind of jumping right in, we've got a lot to cover here, but it really is just kind of talking through, not necessarily giving the advice. So I'm not able to recommend what insurance type or anything, but really able to share all of the support and counseling and resources that are available whenever you may need them, or if you have a friend or another person living with PH that you might be helping along the way, just being able to talk through it. So really empowering. I think it's really empowering just to share resources and feel confident in that any given moment, that there are places you can go to get that support. And again, we're all in it together. It takes a team. So just jumping right in, I think one of the most important things is really feeling empowered and being your own advocate. So knowing that you're able to go to the resources, if it's a nonprofit, if it's Team Phenomenal Hope, if it's your specialty pharmacy, of course, your healthcare provider. There are lots of different experts that are are available. And I think too, just joining this support group today is a great example of coming together to kind of learning, because we know it's so complicated, right? Of not just choosing the right plan, but continually having to do so when there is options for open enrollment each year. Again, with the foundations that we'll get into more detail towards the end of the slides, with those financial assistance, the copay assistance resources, it is constantly changing. I know I've been tracking them for over 7 years of what's open or closed at any given moment. So really being able to know what's the easiest, the quickest way to get the most applicable resources that you may need. And of course, if you do need those additional benefits, whether it's disability, if you need legal assistance, or even counseling around what type of plan to choose, there's lots of ways to do so. So before we jump into some of those, I think just talking about your medical history is super important. Just knowing that every time you're at a healthcare provider visit, it's being tracked on your healthcare record. So we know that you all, having been diagnosed with PH, you're working with specialists that are the experts in this space. I know, speaking myself, not clinical in any background sense or anything like that, strictly on the advocacy side. So I rely so much on the knowledge of our providers, of our nurses, the prescribers, and even our specialty pharmacy nurses are just a wealth of information. But thinking about in telling your story to someone that may not specialize within the PH space. So if you may get sick or have to go to an urgent care just for a prescription, or maybe your primary care physician, or possibly, hopefully not, but if you have to be admitted to the ER, what's the best way you can tell your story in a very short amount of time? We know each day, I think, is a journey, right? And it can change from day to day on what you're experiencing and how you're feeling. But how do you tell that story to someone that may not be as familiar is really important, because we know that does go into your medical record and history. So some of the suggestions that we've had from our providers and our nurses here at CVS is really using more than one sentence. Being able to describe that full picture, use those descriptive words, of course. I know, especially when you're not feeling well, it's really a lot to have to express and explain, maybe not quite from square one, but to give that full example of what you're going through, but trying to think of very tangible things. So I know some people have told me it's really easy to think about at home what their measurement is. So for instance, I could walk to the mailbox today and back without being short of breath, or I could go up the flight of stairs. I had to take a few more breaks today than I did yesterday, or kind of keeping that documentation throughout the week in any given way. So I know everyone works a little bit differently. For myself, I feel like I have to physically write down notes when I'm at work and thinking through my checklist and what I have to do, but lots of other ways that I think we've heard work for many different people, whether it's keeping a small calendar in your purse, or at home on your desk, being able to write just in very quickly, like if it was a good day, anything that stands out. I've talked to some people that even put almost like a smiley face or a frown face, or just a straight line across if it's just you know, anything that can give that consistent picture, where even for yourself, when you're talking at those appointments, being able to say, consistently I've felt okay, but looking back, maybe 2 weeks ago, I really had a rough few days. Being able to somehow have those notes that can really back it up. I know there's a lot of people that may keep daily journals. I'm just trying to think of some of the really great ideas that people have shared. There are patient toolkits that are available. There's symptom trackers, even the apps on your phone. I know there are a lot of smartphone apps that you might be able to keep those notes of what you're experiencing. So just a little bit of of what works for you all and what works best for you, not to make it feel overwhelming, because that can be when you're at the end of the day, you're not really up for maybe writing a journal entry. I don't know if anyone has any ideas of what they use currently that works well with them. If there's anything you guys want to share, I know I threw out a few ideas, but just wanted to
You know
throw
what,
that out there if there's any.
you mentioned patient toolkit. Where, where exactly are things like that?
So there are some, I know some of the foundations have different forms that you can fill out, just almost like your own medical history background. If you have a list of medications that you're currently taking, you know, kind of those full examples, even a list of who your specialty pharmacy might be, or if you're getting multiple medications from multiple pharmacies, getting that information, who your healthcare providers are, your specialists. So usually there are some different things like that that you could even print out to have journal entries. I've talked to a few people that even will email themselves, just keep a running email thread to themselves, and they'll just type, and that way they can look back and have the date, the time of what exactly they experienced. And it's, you know, if it's an easy way to just search your email or keep that at the top of your inbox, you always have it whenever you're experiencing something that might be out of the norm for you, is another idea too. And I know sometimes some of the drug manufacturers have some toolkits, you know, some binders that, depending on what therapies you might be on, they might send those when you start a new medication, or might be able to request that as well.
Okay, thank you.
Yeah. Yeah. One other example, I know someone had shared that one of their friends slash caregiver is someone that they talk to every day. So that particular friend, when they're kind of catching up that day, the friend will keep that journal. So that way they've got it and they can lean on each other when they're maybe, you know, if they're going to the appointments together, it's another set of ears to listen to what's going on, but another person that's able to help express and advocate on your behalf too. So lots of different ways, not to mean to overwhelm. You don't have to do everything, but whatever really does work for you, I think can really be supportive and make you feel like, okay, I don't have to think back, because when you're at those appointments, I'm certain it's a lot to run through and explain, and it's hard to think back. I know sometimes I think back like, okay, what did I have for dinner earlier this week when I'm trying to meal plan? So it's more than just, you know, just the day to day. It's really being able to have that tool to lean on and make you feel like, okay, I've got this. I know what I can rely on, and I can tell my story and get someone up to speed in a quick appointment, and be able to rely back if they're asking for more details too.
Thank you.
Of course. All right. And then we're going to talk about denials. And I know that is not a fun word to hear for anyone. But before I jump into kind of the list here, I know the first thing is always don't panic, but that's really hard to do if you're getting some notification of an insurance denial on medication when it is life-sustaining medication. So first and foremost, please don't panic, as tough as that is. But before you jump into any of these questions and the ask, you know, everything in this column is something that you would need to do. But think about it first when you're hearing about it from your insurance company, whether it's a letter in the mail, or if it's a phone call or something like that. I would say almost always your specialty pharmacy that is servicing that medication, and also your provider that's prescribing it, is going to have already received notification of this and most likely be working on it already. So before even asking any of these questions of your insurance company and your plan and the support that they have there, I would go directly to your pharmacy and then also your doctor's office just to see if they've already been made aware. They might have already put paperwork in to appeal or whatever might be needed just to get that documentation in place. Most likely, they're already talking to your insurance company about it and working on it. Um, if in the case, let's say that you talk to your doctor's office and they say, oh, I didn't realize, or I hadn't seen this notification, I'm going to call their point of contact at the pharmacy, just make sure that you're leaning on your care team there to know what you need to do for next steps, and make sure you're not going down a path that might be unnecessary. Same thing with your specialty pharmacy. Make sure to ask if they've already talked to your doctor's office as well, if they're already working on it. That being said, once you go through those next steps, if you are talking with the insurance company or your pharmacy, definitely asking why is appropriate. Be sure to ask exactly what that denial entails. And if in fact it's an actual denial, I have seen some scenarios where, let's say that the insurance company is requiring specifics from your medical record that your provider is sending over. Um, Sometimes the insurance companies still require that it is sent via fax. I know we can even fax via email now, but if they've got a physical fax, let's say that first few pages went through, and for whatever reason there was a technical difficulty, and maybe not all of that documentation was actually received by the insurance company. So maybe they just closed it out because they didn't get that information. It may not be an actual denial of the medication. So it might just be that they need that information again. And that's something that I know your PH specialists are on top of. They've always got everything ready to go and are working diligently to get everything to your provider, or I'm sorry, to your insurance company to make sure that they can approve this. So definitely asking why. If they are denying it, ask just for more clarification. If there's a review process at the benefits team that you could speak to exactly what the language is, why did they lead, what led to that decision for them to actually deny it, see what you can do. And if your doctor's office, if you're working with them on it, see what exactly might be required in order to have them review that again. We do have on here, ask if there are other covered therapeutic options. The reason being that sometimes those insurance companies may change their formularies. So they might change year to year. Even if you don't change your plan options, they might change exactly what medications or therapies might be covered on the formulary. So that's a really good question to find out. The caveat being, I would always defer to your medical provider, to that prescriber office. They know what's best of what medications, what therapies to prescribe for you, and always go back to them. We really want your provider. They know what's best. Again, I can't say it enough, but they should be the ones saying that this is the medication they feel would be best for you. It should not be an insurance choice of what you're able to get as far as therapy goes. Kind of keep that in mind, and again, always defer back to your provider's office, to your nurses there, to your doctor on what they feel is best for you. And then we do have here, ask your PH care team for assistance. So when I say PH care team, I just think of the full picture. So you've got your healthcare provider, you've got your nurses, your doctors, your specialty pharmacy, your individual support. So if you've got friends, family, caregivers that are in the mix, definitely lean on everyone, lean on all of us. If you've got a patient advocate, I know there are even sometimes independent patient advocates that you may be able to hire to help work through this if you're looking for that extra support too. So just please, I think going back to that, don't panic. Just know that you've got so many people in your corner that are going to be working in tandem collectively to make sure that see what we have to do in order to get you the medications that you need. And I know it's easy to say when we're talking through it today, but it's very scary, again, hearing those words, and it's stressful just having to go through and ask these questions. I also like to add, just in talking to you all today, that if you're getting someone on the phone that you haven't worked with before, at the insurance company or the pharmacy, you know, wherever you're calling in to try to figure out what you need to do, if it's someone where maybe it's just you're not getting the resources or the support that you feel you need, it's okay to ask to speak to someone else. It's definitely okay. And I know it might be a little uncomfortable, but it really goes back to being able to advocate for yourself and being empowered and knowing you're this, for your own well-being. So do not ever feel bad. And I know I've talked to a lot of people in the moment, and I always say every emotion in these scenarios is 100% valid. And I think anyone that's working with you and trying to help in any of these areas understands that ultimately and wants to help. But if you're not getting the help you need or the answers that you need, you know, definitely ask to speak to someone else. And I know I kind of, you know, this is kind of what I had talked through a little bit more, but if ultimately it is denied, let's say, and the benefits are not able to cover the medication that your doctor has prescribed, there are those other resources. So again, talk to your specialty pharmacy, ask those questions, say, I really need this medication. Is there any other resource or support that I can get? Because some of the pharmacies, and I know at CVS with the teams that I work with, and I would say many of the other specialty pharmacies do have that support. So definitely ask in every way you possibly can. I know sometimes I feel like a broken record, even asking on other people's behalf, but it's worth it. And get someone else, like again, a caregiver or your doctor's office is always going to be talking with your specialty pharmacy too. So enlist someone else's support if you're fed up or just exhausted from having to go through all of these phone calls. Definitely use anyone you can. Again, your healthcare providers are incredible and know those questions to ask, know that main point of contact that they can go to. Again, with some of the therapies or medications, some of those manufacturers might have some patient assistance programs too. So there are different, it really does depend on the medication, on the manufacturer, at any given moment, what support there is. But a lot of them do have what they would call patient assistance programs or PAP for uninsured or even underinsured. So even if you have insurance, but it's not covering that medication that's been prescribed for you, sometimes the manufacturer has some support there too. Support groups, again, just a shout out to all of you today coming together. And of course, like I mentioned, patient looking for some of that extra support. It's advocates through those foundations, at your specialty pharmacy, or you know, across the board. There's lots of different ways to get that support. And of course, Team PH, I cannot express enough how awesome you all are, and the ways that you're able to connect to a lot of other resources that might be available.
Okay, I do have one question. Let's say your your medication has been denied. And you've gone to everybody you could go through. And I mean, maybe the foundational funding was not available. Maybe there wasn't, because a lot of the pharmaceutical companies have, how can I put it? How much money you make depends on how much help you get. And not everybody falls within, you know, in that thing. Some of us, what they consider make too much money. We don't see it that way, but hey. So when all
Right.
has failed,
In those cases, and I do agree, and even with those, the eligibility requirements and the income requirements, I know I couldn't pay or afford to put together, a certain amount for some of these copays that I see. I don't know anyone that can. And that in itself is just so frustrating and can be devastating and stressful along the way. In those cases, I mean, I think it's really tough to say it's not a one size fits all, right? Because we're looking at maybe try with your insurance company to see how close you are to getting to that maximum out of pocket amount. Because maybe if it's a little bit more that you might be able to, uh, if you're able to afford it is one thing, but even if you're able to say, okay, this dollar amount I can get on a payment plan and set that up with my specialty pharmacy for this amount of time. But I know if I refill this medication at this copay amount and there's no other resources, that may be getting you to that maximum out of pocket where it might drop down in future refills. So that's something to ask. I think too, always going back to your PH specialist and saying, this is my experience, because they're not able, they're prescribing what they feel is best for you. So at that moment, explaining this is what the copay is, they are already pushing on your behalf. I know that too. Ultimately, I have seen some that it's the provider option. If there is another therapy that might be similar, they might try that. They might be able to appeal and work with your specialty pharmacy to put forth an actual appeal to the benefit or to the insurance company. And then Gosh, I'm thinking, Lanice, too, just of the ways that Team Phenomenal Hope has the Unmet Needs Fund and lots of other resources out there. If it can help, if you might be eligible to qualify to offset some other just general expenses that could help you pay that copay amount for that month and get you closer to that maximum out of pocket. But yeah, really, really talking to your healthcare provider, I think is what I always think is the best way, because if you need to change therapy, that is up to the prescriber, to your PH specialist. And they're going to exhaust every possible option before that.
And
And really, oh, go
I
ahead.
can recommend, I know that I had a hard time with one of my medicines one time when I went to CVS Caremark, and they did work out a payment plan with me, which allowed me to extend it out. Also, I'd like to put out there that Team Phenomenal Hope does have the $500 yearly grant that PH patients or caregivers can apply for. And I know for a fact, because I've done it, get the $500 grant, buy all the food you can buy. Then that normal amount of food you would buy each month, use that to help pay for medicine. It's not a perfect solution, but it can maybe help.
That's right. That's right. And I think it is so overwhelming, especially in that moment. You're just trying to get the medication that you need. I think sometimes on those phone calls, it's like, I don't care. I'm going to put this on a credit card because I don't want to deal with it. But I think in that case, it is tougher to kind of backtrack and get on a payment plan after the fact, other than having those really stressful, difficult conversations in the moment and asking it of your pharmacy first before agreeing to anything. I think exhausting every possible option, and it's literally exhausting. I know just from my involvement in it, and I can only try to imagine, when you're the one placing that order and having those conversations, it's on a whole other level. And I know that is me saying it, so for whatever that's worth, but I get it. And that's why I said every, anger, frustration, like the tears, it's everything wrapped up. And that's why I think really being able to lean on those that you have as far as support goes, and your doctor's office, your nurses, everyone, get that support team, who you're going to go to. And Lanice, like you said, if you've had that scenario where it's almost every month it comes up again and you're going through it, but you kind of prepare yourself for, okay, this is what I'm going to have to fight for, and be ready for that. And maybe just have your approach in mind. And once you get closer to that stress level where it's just too overwhelming, and it is okay to lean on each other. And I know, even if I think I've talked to so many people over the years where, even if it might not be through the pharmacy I'm working for, it's like we're still going to try to connect. And even I think about, even at some of the conferences, all of the manufacturers or specialty pharmacies, like, we're all coordinating. Even if there's a benefits change, if you haven't changed your elected benefits, you might have to switch pharmacies at the start of the year because of the way your insurance plan has possibly contracted with a different specialty pharmacy. So I guess just in saying that, we've got internally, our CVS pharmacy talks to other pharmacies and is trying to help make it as seamless as possible. But again, it is a very complex a system in place, right? That's a nice way to put it. I think we all probably have our own personal opinions, but it's like, the alternative is to kind of, give up, and we don't want that for anyone at all. So really trying to feel empowered, lean on each other, lean on all of your contacts, and get that frustration out. Again, you know, I've talked to people who are at the end of their rope, and crying or swearing and everything. And I'm like, I'd rather you get it out and say it, say it to me, and we're going to move forward together and figure it out. Because don't ever, you as the patient should never um, be made to feel bad about advocating for yourself. And it's easier said than done. But I think just you all in those situations are an inspiration to me, but also we've got to stick together and keep pushing. Right. So that's a long way of maybe not a clear-cut answer, because I know it is so complex. But yeah, those are my thoughts. All right, so let's get into some of those additional resources that we talked about. Of course, we have to do the shout out to Team Phenomenal Hope, the Meg and Michelle Hicks Fund for Unmet Needs. I think the biggest thing, I actually, just a side note, last week was at a healthcare advocate summit, and that's what it came back to is, if we don't ask, we don't know what's available. We don't know what's out there. And it's always okay to ask and apply and try to see what is most applicable for you, and what can help support you overall. So, we've got Team PH here, of course, and we do have some of the other phone numbers and nonprofits. I do like to call out, because I know just we're all in the PH community together, but even down at this bottom right corner, oops, I went forward too far. And I can pull up the screen to show you, but PHA's website does have a landing page that has all of the manufacturer programs listed for each drug therapy. And I can also send these slides out, Tanya, and if you want to share these with everyone that registered today, so that way you guys have all of these phone numbers and websites, and you're not having to scramble to write them down.
That would be excellent.
Yeah, okay, that'd be great, Lanice. So yeah, I know, just kind of here in the center, looking at the marketplace plan options, asking your state, looking at Medicare plan selections. And of course, with benefits, I think insurance is a whole other language. So I rely so much on our specialty pharmacy benefits team to help me understand what individually might be going on with a certain person's situation. And really, it's, again, a moving target of what works best for you. It might even be what kind of medications you need to make sure are covered, and switching that as needed. But really, those counselors whether it be with Medicare or Marketplace and even some of those nonprofits. So that's where here on this page, we've got our copay assistance and foundations.
Wait, can I just cut in for 1 second? I'm sorry, 'cause
I see what you're saying. Yes, so you're meaning for the actual medical procedure, not any medications, right? Yes, and I know there are so many resources out there. I would suggest because with UCSD, I know they have a great PH program. I'm not certain off the top of my head if they have almost like a social worker support that might know. One organization that I know of, and once I stop sharing these slides, I'll pull it up on the website. But it's actually called Dollar4, FOR. And this gentleman had founded Dollar4, which is an organization that can help with medical bills in hospital systems. It's really interesting. I've heard him interviewed on a few podcasts, and he was actually at that same summit that I was at last week. And they've been able to help more on the medical procedure side and hospital bills to help, because there is something that most hospital systems might have what they could have a variety of names for it, but it's almost like charity care. So they do have built-in support at the hospitals that they know. Not even like payment plans or necessarily even income driven, but it's something that could help with some of those bills, and even being able to in some scenarios like write them off, where they could greatly reduce the amount depending on what your insurance coverage might be too.
Yeah, I just included the link for Dollar4 in the chat. I found that while she was talking.
absolutely.
You've got it,
And you know
Kira.
what?
You're always
I'm
so
kind of,
quick.
is it she? Not me. Thank God.
I
Everybody's
love
good.
it.
But you know what though, and that's an interesting thing to say, because I know for myself, I had so many medical bills because of surgery and different procedures at Mount Sinai Hospital in New York. And I went through their program and they wiped the entire thing out. I mean, yes, I had to go get uh, documentation from my doctor, which was no problem. And I could pull from my chart the other things they needed. But just the fact that they wiped out over $1,000 was a big help to me. So yeah, check that out.
That's exactly it. And it's the full picture. I know we're talking about copay assistance and medications, on this side of things, but that's one piece of the puzzle. So, um, I know everyone's a little bit different, and people are kind of like, well, if I can pay, I'm going to, but if this support is there, I think it's there for a reason. I've talked to some people that say, well, even for copay assistance grants, well, I don't want to take it if someone else is in greater need. But that, I think, for the foundations that I've talked to, that is encouraging for them to see that they're utilizing. They don't have this funding that's going unused or that's unnecessary, that people don't need it. So it's there for anyone that may qualify, and I think it's worth even sometimes getting that no. If you get that answer, if you apply and they say you're not eligible for this, at that point, then you can go to the next step or go back to the manufacturer, say, I've already tried. I've already tried to apply for copay assistance, and it was open. It's closed now, or I wasn't eligible based on their requirements, because not every single one has the same threshold. If they do review your financial situation or income, each one may have different qualifications too. So I know it can feel defeating in that moment, but use that no to open the next door is typically what I try to have, like, the mentality around it when I'm talking to others too. Yeah. Yeah, and that dollar for any of you guys that listen to podcasts, I mean, he is really impact a great speaker, and just hearing the story, I know he's been on quite a few different podcasts, and that's where I was like, wow, I didn't even realize, this had existed. And I think ultimately what they do is, even when those hospital systems, like you said, Lanice, your experience, you were able to go through the program that was available there, but if you're kind of running into those walls, their organization can help navigate it, because they do with so many. And I think they've saved people. I don't even know what the current dollar amount is, but they keep a running tally of millions of dollars that they have saved people over the years since they started.
Excellent.
Yeah. All right. So then I was just going to say a little bit more on some of the foundations, is truly that each and every one, we know they can open and close based on funding availability from their donors at any given moment. But it's really great to have an awareness of what is available. And each one, again, not just the eligibility requirements, but each one of their application process, and even the types of benefits that they accept, or the dollar amount that they will offer if you are approved. It's different for every single one. And they keep it really fun and interesting, that they might change it year to year. So, I've got to have that mentality when I'm tracking them. And then as soon as we see that something has changed or opened up, I know I share that with our entire internal team, and then everyone's spreading the word. It's with our nurses talking to their patients, our account reps out in across the country talking to your doctor's offices, just sharing these resources, because there are so many moving parts at any given moment. So a couple top of mind, just to kind of run through some of these on the screen, and then I'll pull up my web browser too at the end, so we can look at how they are. But I think the assistance fund, consistently, what we've seen the last few years is, when they are open, they accept all different benefits types. So they accept Medicare, Medicaid, government insurance. They do also accept commercial insurance. So I think that's one differentiator there. They also, if you are eligible, a lot of times what they'll do is approve you, if eligible, for the entire calendar year, and they don't put a dollar amount limit on that. So that's one that I think is really helpful to so many. Even when someone might apply, and it does depend on the time of year, but even I think just last month I talked to someone that had applied, and they backdated, the assistance fund actually backdated it to the start of this calendar year. So that was able to help that patient who agreed to the copay in January but still could not pay those bills. They were able to utilize that grant. And a lot of these will backdate. It just depends on the time frame. Like, I know Healthwell sometimes will backdate it 1 month. So you'll get your eligibility dates whenever you're approved, to see when it is effective. So that's something, once you do get your grant information, definitely tell your specialty pharmacy. The other thing I'd like to kind of call out is, you could have multiple specialty pharmacies for, if you're on, let's say, 3 different pH medications. You could have two different pharmacies, and then also, let's say, a manufacturer program that you're ordering from and getting assistance from. So each pharmacy could actually bill the same grant. You don't need a different foundation grant for each pharmacy. That being said, if it does have a dollar amount limit on the grant, you're going to see that both of those pharmacies are billing the grant at the same time. So it may exhaust a little quicker if there is a dollar amount limit, not the way that the TAF actually does if it's unlimited for the year. So that's one piece. It is also difficult, I think, when you're placing your refills. I think it's important to ask what the copay is if someone's not telling you, or if you don't hear that copay amount, or if they say it's covered and then you do get a bill in the mail. Oftentimes, if you did not agree to that, I would talk to your pharmacy and say, you didn't tell me there was a copay. I did not agree to this. I cannot afford it. And then at that point, if there is a foundation grant that you have, they could apply that, or they could go through and kind of research on that call too. So I usually like to tell people, definitely ask if you're getting bills in the mail and you're not quite sure why. And it may be that even, let's say that you do have a grant that's on file and maybe it didn't, in that billing cycle, didn't get applied to the grant. So there's a variety of scenarios, but again, just always ask. So then the others with Patient Advocate Foundation, they do have a dollar amount limit. I think typically for the PH fund that they have, it is Medicare and Medicaid only. And you don't have to memorize these or keep your notes again, because it's always going to change. So I always tell people, ask your pharmacy, ask your doctor, or go, if you've got internet access, and go to their websites, do that. And I'll pull those up, like I said, again. Pan Foundation actually just recently, within the last month, they opened up their fund for PH to all different benefits types. So now, similar to TAF, they do accept commercial insurance too. So that's brand new for Pan this year. That's super exciting, because I think it's tough. Even if you have commercial insurance, that doesn't mean the copay amount is fully covered, even if you have a copay card. So kind of keep that in mind. And then Healthwell Foundation, of course, they currently only accept for Medicare and Medicaid. And if you are approved, they have grants up to $10,000 for that as well. Let's see, each of these do also have online patient portals, or you could call in. Some have some different phone lines that you could just get an automated information. If you've got your grant information, you can plug that in on the phone to try to get the current balance that's remaining. With that, though, if there is a payment pending, or if your pharmacy is still billing, it might be complete to speed. So I think it is kind of all those things in motion at the same time. You just want to make sure to kind of keep on top of it. If you see something was double billed, or if you're getting a different answer from your pharmacy, it is helpful to call a lot of these foundations at the start of the year. The hold times are to have internet access, or if you've got a friend or family member that's able to log on and help you with the application, I think that is quickest. I think sometimes people will say, well, if I log on there, they're gonna, I won't have that answer right away, and I've only got 2 days left of medication. So that can be kind of worrisome. It's still worth doing, because some of them will give you that answer and that grant information immediately. Others may give you a temporary approval, and they may require that you send in documentation. So it is very, again, complex, not an easy task, and it's, I'm sure, like a full-time job, just sorting through all of these different things. But I think it's just helpful to keep in mind whenever you're running into those roadblocks or hurdles, to definitely lean on all of the support that you have. Additionally, a lot of these foundations, I know Patient Advocate Foundation and PAN specifically, they do have those benefits counseling resources. So if you're like, this plan just is not working for me, I will oftentimes recommend going to these organizations and talking to their insurance counselors, because they can talk through, they know the space that these medications fall in. With rare diseases, with specialty pharmacies, they know the ins and outs of the benefits side of things too. So I think they're a great resource to utilize. And with, if you do have a grant that, when you're placing your refill in the middle of the year and they're saying, well, the dollar amount remaining isn't going to cover the full copay, what you could do is see if you could apply for a renewal. I know the PAN Foundation sometimes will offer up a second grant for the year, where you just have to click through and they will approve you almost immediately. It's just, they kind of limit it to see if if you would need that entire funding, or if possibly you're going to meet your max out of pocket with that first dollar amount. So you may just kind of have the mindset you may have to apply to more than one foundation throughout the year. I know it's really tough because sometimes for those that have been diagnosed for a while and getting assistance, it's almost like, well, I thought I took care of that at the start of the year, and not anticipating that you're going to run through it. Um, and if you know is a specific dollar amount, you may get close to that, but there's always all of these other resources that we can work through. Your specialty pharmacy can work through to help throughout those scenarios. And typically you are going to have to reapply each year, or if you did, let's say someone applied to HealthWell and were accepted in May, oftentimes you're not going to be able to reapply until usually a month before that official end date. So it is complicated where you, depending on what your benefits and your copay amount is, you may run out and exhaust that funding before the end of the actual time frame that the grant is eligible. So in some of those cases, you might have to apply for another grant, and just keep it in mind. Again, there's no one answer. I'm learning something new every day. I'm like, oh, even the scenario of the PAN Foundation changing and offering it up to open to all different benefits types is something new. So I know this is almost overwhelming. It's like you could study it and it might change again next year. So kind of think of it as, again, a moving target is something that we will anticipate that it is going to change. And that way it's a little bit less stressful in those moments when having to jump through the next hoop. I know that doesn't make it any easier to do so, but if you do have that mindset, I think that help in the moment to know, okay, this happened. Now I'm going to go to the next resource that's available for me, and keep that in mind. The other piece too, just in talking through it, and I know it's a lot of information again, but I have had some people in the scenarios that they did reach their out-of-pocket maximum and then their refills were fully covered. There was a $0 pay. So the pharmacy did not need to actually bill that foundation grant. So some people might get a letter then that says, there haven't been any claims to this grant in the last 30 to 60 days. If you don't utilize this grant within the next 3 months, we are going to rescind the funding. And that sounds scarier than what it is. So that's another one to double check, whether it be with your insurance company or your pharmacy, and say, did I reach, is this fully covered? Is there a $0 copay for the rest of the year? And that might be the case. Of why the funding is being rescinded. And essentially it's because the foundation is pulling that dollar amount back into the larger bucket, for lack of a better term, of that grant availability. Don't be alarmed if you do get that letter. Oftentimes it is that it's a $0 copay. So your pharmacies or specialty pharmacies are not able to bill any of these foundation grants if we don't bill your insurance first. So that's in the case that one of our benefits team explained it to me, like, even if the insurance pays 1 penny for this drug, then we can submit the rest to that foundation grant. But it has to go through insurance first in order to utilize any of these foundations. Again, if someone does not have insurance, that would be the uninsured programs that we could try through the manufacturer in those cases. So I hope this isn't overwhelming in a negative way. I know it is complex and complicated, but just to talk through it, I think helps to know there are so many different moving parts, but there are resources that are available at any given moment. And it's kind of like once you're faced with this scenario, you're in the mix and it's like, okay, wait, what do I have to do? So that's where, again, to lean on all of the support that you have from your pharmacies, from your manufacturers, from your healthcare providers, and of course our foundations that are all together. Okay. And then I was just going, again, all of these slides we will share with you all, but just to show, and I know lots of different companies, pharmacies, manufacturers do have some resources, but this I like to share because even if you're not using CVS specialty, that's okay. On this right side, we have a PDF that on the back, we try to list all of the different known financial support, foundations, our different nonprofit partners in the PH space for advocacy, education, and of course our government resources too. So we will include this after the fact. I know Lenise and Kira will get this out to you all. And then I put some screenshots together here about Fund Finder. So this is another resource, and what I'm going to do instead of kind of talking through the slides, I'm just going to pull it up. But Fund Finder is something that the PAN Foundation did create that is an easy way at any given moment to log on. It's a web-based resource. You can just go to their website and create a quick account, and you're going to be able to see what's open or closed and have direct links to those foundations too. So we'll jump back to that in a second. And then, of course, our cvsspecialty.com PH Resource Center. Again, you do not have to use CVS to access any of these resources, but we've got lots of different articles online. And I like to call out, especially in this support group topic, the making sense of financial support programs. And it's talking through, again, it's an article that kind of mentions and details some of the scenarios that you might be going through and the different people that you would and companies that you would need to talk to. All right, so let me go ahead. I'm going to stop sharing the slideshow and we'll pause real quick. Do you guys have any thoughts or questions, comments, anything right off the bat after we covered all this information?
And like, okay, somebody's got their hand up.
No, that's a great question. And I think that's one thing that I've talked to a lot of our manufacturers, and of course, working with Team Phenomenal Hope, PHA, everyone's trying to get the details of what we can share or what is out there that we could kind of relay. I have seen a few pieces and I don't have the specific details yet, but I know at that time, once anything is officially available from Medicare, that we could message. Our pharmacy team will be doing so. We'll be talking through it and being able to point to some of those resources. But I think from what I've seen right now, it's kind of every kind of sector in the PH community on the industry side is working to get some communication that will simplify whatever that messaging is from Medicare. And I'm sorry, that's not it's like a non-answer, but I'm still waiting to hear the best way for even our benefits management team to kind of relay it for me to verbalize that too. But I'm hopeful, and that seems to be the big kind of approach with others that I've talked to, is that everyone's hopeful that it will benefit quite a few, but I think it's working through it once it is active and we're having people that are in those scenarios. So I think, again, it goes back to just sharing the resources whenever we've got them, spreading the word. So some of it does depend on the benefits type. Is if we're able to offer, let's say, a copay card, if it's commercial insurance, or if there is a program that we might be able to refer to our what we call the RCC at CVS. That's our dedicated team that can help try to find any type of copay assistance that might be available. So I know I tend to recommend that anytime that you are being told there's a copay amount that you can't afford, definitely, I think it helps to be on a fast track to explain right off the bat, I can't afford this. Is there anything else, any support available or any other assistance available? And even just like that quick, is what I typically would recommend. And again, because even with that RCC team that I mentioned, and I can't speak to what some of the other specialty pharmacies, I'm not quite sure what their process is, but I would suggest to anyone that go ahead and verbalize it right off the bat.
And the RCC team is what now?
And I'm sorry, Lenise?
What is the RCC team at CVS Specialty?
That's the Reimbursement Counseling Center. So that is a dedicated team that can help to see if, let's say you're on the phone with our PAH care team, and I'm going to pull up that marketing piece again, because I think it helps for me to talk through it a little bit more. But if you're calling in for a refill or even to schedule your first shipment, and running through those copay issues, typically our team on the phone, if you're saying I need copay assistance, I talk to our, what we call patient service reps on a daily basis. There is an email every morning saying, these are the foundations that are open, direct to these first. If a patient needs copay assistance, go to the assistance fund, go to PAN Foundation, give them the phone numbers, so they're able to do so. But we know not everyone, again, might not have internet access or might not have time that day to sit on the phone on hold waiting to talk to someone at a PAN Foundation. It's time consuming and you all have other things that you're working on too. So if for some reason, someone's not able to do so on their own, or if someone expresses like, hey, I can't do this. Is there anyone that can help me? Then our team that's answering the PH care line is able to have the RCC, that Reimbursement Counseling Center, call the patient back. And that way they can call and work through, they can say, these are the foundations, but if you've already tried or if you've exhausted your funding or if nothing else is open, that RCC team at CVS would be able to talk through any other options there too. Yeah, and they are separate from the billing team. So I know even that it sounds like there's just all these separate silos, but everyone is working in tandem and communicating with each other. So that is for those of you that are on service with CVS, you'd be able to utilize, and let me pull up, share my screen again. Yeah, that's a really good question, Sarah, just because even if you're talking to someone at the pharmacy and you're not getting those answers that you need, that's where you can ask for that extra help.
Okay, my other
Okay,
question while
so-
you're pulling this up is that the foundations that you showed us, is it only for help with urinary hypertension, or can we utilize some of it for other diseases, scleroderma, liver diseases? Is it just for pH, or can we use it for other things?
You are reading my mind. Perfect tee up. So most, as always, most of these foundations have multiple, what they call disease funds. So multiple conditions. I've talked to a lot of people that will have more than one grant through the same foundation. So like Health Well Foundation, you could have 2 or 3 different grants through with different ID numbers, different billing numbers. So all of that information for anything that is FDA approved to treat PH would go through your pulmonary hypertension funds through that grant. But if you have other medications, like you said, for scleroderma, for pulmonary fibrosis, different things like that, there are dedicated grants through some of the same foundations. So let me pull those up because I think it is helpful just to take a look instead of hearing me talk so much about it. But on this page, so this is the front page of what I had mentioned where we've got all of them listed for PH on the back. But on the front is where we've got that information about the Reimbursement Counseling Center, or RCC. So though that's kind of that extra level of support that they can contact you if you're serviced by CVS. Still call this main PH care team, because that's the dedicated team that is constantly looking for grants and able to really be the specialist on the CVS specialty side within PAH. But they are the ones that can create that outreach from the RCC to contact you directly. We don't have a phone number until you're connected to them. And then after they reach out, they're going to call, they're going to leave a voicemail with their phone number where you can call back if you can't speak to them right then and there. And they're amazing. They can really talk through some of the support that might be available.
And I'm thinking that probably most specialty pharmacies have something along the same vein.
Yeah, I think so. And I just don't know. I don't know the names of their teams or like the phone numbers that they've got listed. But again, I'm certain that the PH specialists and your nurses and doctors would know exactly who to go to for you.
Thank you.
Yeah.
And again, we're going to send this information out to everyone who registered. Will be receiving this packet. Thank you, Marcie, for that. Because it is
Oh,
a lot
yes.
of information. I mean, it is a lot. I mean, I was scribbling and I saw other people scribbling frantically. Does anybody else have questions? Now's the time. Okay, Deb.
I would say whenever your benefits are active, they can even run test claims is what they call them. So they can put it through to see what the copay would be. I think there might be a couple caveats depending on if it's
Yeah.
sometimes medical or whatnot that they're not able to see until after the fact. But that's why I would recommend always asking, do I have a copay? What's the copay? And if they don't know right
Okay.
then and there, then you can request that they let you know before you would agree to anything. Mm-hmm. And that may be the case. So that is one one piece where if you are asking and they can't run that test claim, it might be because it's like refill too soon, where they can't get that actual dollar amount until a certain number of days before they could refill it. So I know it is kind of, you're trying to do your due diligence ahead of time to not be in that situation. But that would be one piece of that they're not able to see it until the claim would go through, even a test claim, because of
Gotcha. Okay.
the number of days before they could actually put it through insurance again. Unfortunately,
Okay.
sorry. One thing I did not stress enough, I think earlier, is sometimes when it does come down to 10 days before, 5 days before running out, or even less, over and over again, be that broken record and tell your specialty pharmacy, whoever it may be, I only have this many days left on hand. I have this many days. And if it's an insurance issue or a copay, or they're trying to figure something out, I always would ask to say, is there an emergency shipment? I cannot miss any doses of this. Is there something you can do in the meantime? Whether it's called, there's a variety of different types of emergency shipments. But I know if it's through the pharmacy or if it's through the manufacturer, ask those questions. And I just always encourage people, again, reach out to your contacts that you can lean on to be that squeaky wheel. over and over again, say that, down to this many days, we have to get something out. They cannot go without this shipment. So don't ever feel bad of pushing and expressing it over and over. And it is, again, a scenario you don't want to be in, because that is a scary place to be in, but rely on everyone you can to push. And that is a frustration. Like, even I know towards the end of this year, a lot of people are going to be asking what's going to happen in January. When everything resets, and what foundations are going to be open? We truly don't know until we're in that moment. So if you are getting paperwork, if you've got a grant this year, and you get paperwork or emails that say, submit your re-enrollment, try to do so as early as possible. I know with the assistance fund specifically, even with their re-enrollment period that goes on, we've seen that the earlier you submit your re-enrollment and get confirmation that they received it, that's not necessarily that you were fully approved, but it's still kind of that first come, first serve of the dollar amount of funding that they have available. So I think it was maybe 2 years ago, I saw that someone had submitted it on the first day that re-enrollment opened, and then someone else did maybe not even a week later. And the person that got it in right away did get approved, and they had run out of funding by that later date. Even though they got it in time, it's still not guaranteed. So I think it is, keep in mind, like, we know it's kind of that mad dash when we know what's available, but just if you're prepared for that, I think that helps. Like, get all of your financial documentation together, have all of that information about your prescriber office, because some of those do require that you enter it. I know Pan Foundation does. Each one, like I said, the application process is a little bit different. So kind of keep that in mind, and just be ready, and or lean on someone else to be ready with you, right? And just kind of have your plan in place of how you're going to approach it, and then you can get through it together. And as soon as you do know of those grants, if you are approved, make sure that you do tell your specialty pharmacies so they can upload it or put that new end date, and that if it was renewed. And that way, it's not just that the pharmacy is saying, no, this expired or it's exhausted. You have that new information to go ahead and tell your pharmacy.
I think one of the most important things here is first come, first serve. So jump on it when you first find out that it's open. Anybody else with questions? Oh, you're
Yeah, I was
Joseph?
just real quick, if you can you see my screen here with the different foundations? So
Well, I'm
I
sure
was
everybody
just
else
gonna
can.
show. Okay, okay. You see it? All right. So each one will show exactly, like, this is the PH fund for the assistance fund, and it's going to show if they're open. It's going to say what the criteria is, what type of benefits that you have been diagnosed with the disease that you're applying for. And it's going to show all of these different medications and treatments. So this one in particular doesn't show some of, like, what they would consider blood thinners. But I think over on, when we look at the Pan Foundation, they've got something similar. Let's see. And they do have some additional medications that they would cover, you would be able to bill under your PH grant. So kind of keeping that in mind, if you do have some additional medications in addition to those specific FDA approved therapies for PH. But you're going to see all of the different things that they're going to, like even warfarin is covered under this PH grant. So if you do have a high copay, you could utilize the same grant for that as well. But then again, you can see there are different requirements, there's different availability, and even each one, to the point that you made earlier, Lanice, like, each foundation does have multiple conditions that they might have grants available for. So if you've got different diagnoses and you want to check it out, I think it's helpful. Like if these resources are here, even if you've got kind of a smaller copay, it still adds up over the course of the year, right? And some people that might pay out of pocket too, if you have a grant that you apply for later after the start of the year or a couple months later that it opens up, if you've paid directly on those copays, a lot of them will let you submit for reimbursement directly to the foundation if you've got a grant too. So if you paid a copay, you might be able to go back and look to see. So even here, you're going to see if they're open, if they're closed, if they have a wait list, and that's similar across all of the different types of foundations. Here I was going to show, so this is fundfinder.org, the one that I mentioned you can log into. They do not send any spam, any junk mail, any asking for anything, but if you log in here, you can create an account just under this sign up. And really, I'm gonna log in. So I'll put my email address and I've created my own password. And again, if you're not getting online on a regular basis or don't feel comfortable, maybe ask someone else, a friend or family member, and you'll be able to see. So Fund Finder shows all different, you can track the different conditions and choose and pick what you want alerts for. So you can see here, if I click on my funds, these are the ones that I most often am looking for across multiple disease states or conditions. So you're going to see here on the right side, if there's a red lock icon, there's no copay assistance or premium assistance available. But if it's got that green unlock, you can click on the drop down and see the different, the different foundations, but also you can click on the actual condition. You're going to see what's open, what's closed, and actually be able to click through to see what's available. So I just think this is a really cool way, instead of having to go to every single website, you're able to go to Fund Finder and click through to see right away. So I'm going to pull up, I don't know why I didn't click on just the PH one in the first place. But yeah, you can see here then under PH, all of these different foundations are going to show if they've got copay assistance, or if you're paying out of pocket for premium costs, you might be able to apply for support there. It's a lot of different things that are available. So we're going to click through. Good Days did recently just close, I think last week or the week before. But it's going to take you right to that page and be able to find the condition that you're looking for help with. And you're going to be able to apply here, or just know that if you prefer to call in, you're going to have all of that information right there. Yes. So I just wanted to show that. Let's see, what else was I going to show? While
Would
we're
this also be in our
all
packet?
together at the time.
Would this
I'm
also
sorry?
be in our packet?
Yes, so that link for fundfinder.org is
Mhm.
actually on the slide. Yep, yep. And this is that page that I was going to show that has, once you scroll down, if you scroll down, you're going to see on this, and I can drop it in the chat too, but you're going to see manufacturer patient assistance programs. So that's when you're being told there are no resources. Let's say there's no foundations open, or there's none for your type of benefits. You can click through here, click on the medication you need help with, and then it's going to pull up, like here for Orenitram, it's going to show the UT Assist program and phone number. So it's just another way to know that you've got, if you're taking these different types of medications or therapies, you're going to have this information. I'm certain of it, but it's one place to go if you might not have it right at your fingertips. And similarly, I know, like I said, I don't know all of the details around some of the other programs, but on the same page, you can find the other specialty pharmacy phone numbers too.
That is like so cool. It's like one-stop shopping.
Yeah, that's
Oh,
right.
really? Yeah. My last question is gonna be this. Does it matter, like, say, do you need like thousands of dollars a month? Hundreds of dollars or $50 a month? That's the dollar amount that you would need. Is there like you have to have it, like you have to need $1,000 or $800, whatever? Can it be somewhere where maybe you're just struggling to pay $300 or $200 each month? So does that
Yeah.
amount matter?
Each situation is your own. So if you can't afford it, yeah, and you're able to get a grant, you can apply it. It doesn't matter how little or how much. If you've got a copay, you could use the grant for that if you're eligible.
Excellent. I'm gonna have to check that out because as you were, most of us have something other than PH. So this would be really, really. Thank you, Marcie. Thank you so much.
Oh, thank
So
you.
much.
Thank you
It
all.
is so informative, and there you go. And we all need to know that there's some place we can go because this is not a cheap disease by any stretch of the imagination. I would like to thank you all for coming on. Got to even mention November. In case anyone knows it, Noah Greenspan is going to show us how to do soft exercise. Soft exercise. Now we're running all over the place. Soft exercise. And that'll be in November. We had moved, Marcie is usually in November, but we moved her up because everybody, because it's open season, we wanted you to be able to have this information so that if something changes, if you're going to change your insurance company, you know which way to go. I'm so thankful for everybody. I thank Kira for always helping me out. I can't see really one spot. But I pray that you all have a great month. The weather's getting cooler. Breathe easy. And I hope to see all of you back in November. So take care. Oh, and the survey. Please do the survey. And take care. Be well. Marcie, I'm getting ready to call you. Everybody, take care.